Well, thank you, Rob. Good evening. It's great to be with you. And for almost 50 years, the CPS has been an incubator for ideas for the centre-right, championing, Rob, policies that promote enterprise, personal responsibility, and the freedom to choose. And these are the policies and values that should be at the heart of every decision that we make as Conservatives. They're values that matter hugely to me personally. And they form the basis for my remarks today. Conservatives are all about giving people the freedom to control the most important asset that they have, which is their own health. Because like economic security, good health is imperative to leading independent lives. So as Rob just touched on, we gather just a week before the NHS celebrates its 75th anniversary of its founding, then there is indeed much to celebrate. The NHS is treating more patients than ever before, and it's using cutting-edge medicine day in and day out. But we must also acknowledge that services face sustained pressures. And much of this stems from the pandemic. You only need to look at the graphs showing the numbers of patients waiting more than a year for an operation for surgery to see the impact that the pandemic has indeed had. The virus left behind long waiting times for patients who had their care delayed or cancelled, and it placed a huge burden on our NHS and social care staff, who responded with dedication and commitment. But faced with these bigger challenges, we now need to be more open to the bigger opportunities that COVID's shown in terms of the potential for change. And that's exactly what this Conservative government is doing, and the PM has quite rightly at the heart of that put cutting waiting times as the key change that we need to deliver. And our 3 recovery plans reflect this focus in terms of the electives, the urgent emergency care, and the primary care recovery plans. And I've been very clear with the NHS that this is where I want our focus to be. And in return, we have been also clear with the NHS that there'll be fewer targets and less management from the centre. And as Rob and I have spoken about in the past, I think show matters much more than tell in politics. And so the NHS mandate published last week illustrates this point, a short and clear document that is half the size of previous years. Now, cutting waiting lists is not just important for patients, it's also important for the economy as well. People leaving employment due to poor health is an increasing headwind for wider economic performance. But again, there are signs of progress. We've virtually eliminated the 2-year waiting list for elective operations like knee replacements that we achieved in the summer, and we've reduced the long waits above 18 months by over 90% at the end of March, showing that the NHS in England is on the path to recovery, whereas the Labour-run NHS in Wales is lagging far behind. We're using technology to end the ATM rush for GP appointments. We're delivering 5,000 more permanent beds to get patient flow in hospitals. And in the coming days, the NHS will be publishing the much anticipated long-term workforce plan. This, for the first time in its history, and I think it's worth emphasising, the first time in the NHS's history, will set out plans to recruit, retain and reform our workforce for the next 15 years so that we can better meet the needs of patients. Because too often, our health system does not put patients first. And that's why we need to double down on giving patients more control over their care through initiatives like Patient Choice and the work we're doing to update the NHS app so people can access their own medical records, they can manage their prescriptions, they can make appointments, and indeed they can sign up for clinical research, and patients should have greater control of that. And indeed the same principles should apply to public health too, and in particular to prevention, supporting people to make healthier choices throughout their lives, because it's in their own interests to do so. We need to give people the knowledge to understand their own health and the freedom to decide what's best for them, the freedom to live their lives as they see fit. So as a Conservative Secretary of State, it's not my role just to be a custodian of the NHS. Instead, to paraphrase the great Ronald Reagan, it's to build a health system that protects and empowers people but doesn't try to run their lives. Now, too often prevention has been dominated by the ideas of the political left, and that shouldn't be the case. And I'm truly excited by the opportunities that technology and innovation are presenting to reset prevention and recast it from a conservative perspective. Demand for healthcare, as colleagues in the room will know, continues to rise. The pressure on public finances is growing. Our population is aging. Medical advances mean we can do more in our treatment. If you look at the contrast, when the NHS was founded, it had less than 145,000 staff and an annual budget of £11.4 billion. To put that in context, today it employs 1.4 million people and has a budget approaching the GDP of Greece. This means it delivers much broader, more comprehensive care than was the case 75 years ago. Indeed, on a typical weekday, around 70,000 people attend A&E. Over 370,000 people attend outpatient appointments. And more than 1 million people use general practice. Yet demand is rising further still. From my experience working in the Treasury and elsewhere in government, I know there are consequences if we were to allow the NHS budget to grow without control. Two examples illustrate the size of the challenge ahead, which makes action on prevention so pivotal. Firstly, 1 in 4 adults across England live with 2 or more health conditions. And secondly, people over 70 are 5 times more likely to visit a GP than younger people. And indeed, the number of people over 70 is indeed rising rapidly. Most agree that prevention is the only way to bend this demand curve. But what I believe is that the only way we can do this is by giving people the tools to take more responsibility for their own health. Now, I know this isn't a universally held view. A belief in personal freedom remains a dividing line in our politics. Labour seeks universal models for prevention, seeing comfort in a one-size-fits-all solution, even if this leads to poorer outcomes. That is why they so often talk about tax and banning things, thinking that helping a few justifies making everyone else comply. To me, the Conservative approach is one of pragmatism, giving people more freedom because they have a strong incentive to choose outcomes that help their own health. It recognises that health needs are more bespoke because disease is a complex mix of genetics, of the environment, of lifestyle. Look at the Welsh Labour government's announcement today to ban meal deals with products deemed to be unhealthy, taking away consumer choice at a time when cost of living is a concern for many families. Or their minimum alcohol pricing, which means some pubgoers in Wales pay, on average, 68p more a litre of cider than they do in England. And nor do I share the Labour Mayor of London's view that Wimbledon adverts should be banned because they have strawberries and cream. On the other hand, this Conservative government is giving people more choice. We want families to have the freedom to choose which deals work best for them as they plan weekly budgets to meet the pressures of higher food prices. The war in Ukraine, the wider global economic situation were not a factor when our proposals on buy one, get one free were drawn up, but they are now. And that is why we have taken the decision to delay the introduction of bog-off. That sense of pragmatism means that I accept that on occasion government does need to intervene. I'm pleased there's a political consensus to reduce smoking, and steps taken over the last 13 years have made material progress. And when it comes to our children, there is a case for even tighter controls. Take vaping. As Professor Sir Chris Whitty, the Chief Medical Officer, has said, if you smoke, vaping is much safer. If you don't smoke, don't vape. And marketing to children is utterly unacceptable. This is a pragmatic approach that this government is taking forward. Smoking has long been recognised as the biggest cause of cancer, and it's right to encourage smokers to switch to vaping. But it's wrong that disposable vapes were being marketed to children when it was illegal to sell vapes to children. And as a father of 2 young children, I know how frustrating it is when parents see products which are marketed specifically to attract children. That's why we recently cracked down on underage sales with our illicit vaping's enforcement squad, and why we ran a call for evidence on youth vaping, and we are looking closely at the evidence on the unknown long-term effects, and we'll be announcing further steps soon. This is how I'm approaching public health in my role as Secretary of State. A deeply pragmatic approach that empowers adults and better protects children. It's an approach that I know the Centre for Policy Studies has already championed, including through the paper Powerful Patients and Paperless Systems, which my colleague Alan Mack helped author. And it's the reason why I've also asked Rob for his input into the work that Professor John Deanfield is doing. It's great, John, to see you. Is leading on a more personalised approach to prevention. I want to give people the tools and knowledge to navigate the system quickly and effectively, being realistic about what works for busy people with busy lives. We all know that family members sometimes put off going to their GP until symptoms have advanced, often for understandable reasons. Balancing work and family life can be tough, and often your own health is sidelined. That's why we are making it much easier for patients to get the care they need at a time and place that suits them. Starting new oral contraception with a trip to your local pharmacist instead of needing to visit the GP. Allowing a patient to directly refer themselves to physiotherapy or podiatry for certain conditions, rather than having to complete an obstacle course of appointments before being referred. Giving patients access to their test results, as I mentioned a moment ago, on their NHS app, rather than requiring a GP appointment. And using the time freed up for GPs so they can deliver the high quality care which we know they want to do. Simple, common sense reforms that allow patients to tackle illness earlier. This is exactly the mindset we need to approach prevention. People in politics often talk about cutting red tape. In pharmacy, that's exactly what we are doing. At the moment, the rules say you cannot collect your medicines if the pharmacist isn't there, even if they've bagged it and it's ready to go, and we're changing that. The rules say that they must deliver the exact quantities of medicine prescribed, so pharmacists waste time opening boxes and snipping up the pill packets, and we're removing that burden. The rules make pharmacists waste time supervising basic tasks, ban modern ways of doing things like the hub and spoke models, so we're going to change that. There are lots of limits on what pharmacy technicians can do, so we're changing the rules to free up pharmacists' time for their patients, speeding up access to care and cutting waiting times. The lesson from COVID is that amongst the interventions that we're taking, vaccination is one of the best value interventions we have to protect the public. We are already seeing how innovation from our life science partners are applying this to prevention more widely. Think about the HPV vaccine in reducing incidence of cervical cancer, or hepatitis B for cancers of the liver. And indeed, just earlier this week, the JCVI issued an update on the potential for new vaccines in RSV, a nasty respiratory condition which affects both babies and the elderly, and which places pressure on the NHS each winter. Looking forward, our partnership with BioNTech and Moderna mean we may be among the first countries in the world to offer vaccines for cancers, including melanoma and pancreatic cancer, personalised to the level of the individual. And this personalised approach applies equally to tackling our other biggest health challenges. Take obesity. We know about the health risks of carrying excess weight. Obesity is the second largest cause of cancer and a major driver of heart attacks and strokes. Of course, diet and exercise are important, but many of us struggle to lose weight and consistently keep it off. The dieting industry has made millions out of that fluctuating willpower. The solution in my mind is not to shame people into trying harder or to attempt to revolutionize our society's entire approach to food overnight. Instead, I want to build a prevention strategy which is resilient to the wider environment. Of course, there will always be a need for initiatives to boost physical activity, such as our commitment to school sports, or the opportunities presented by social prescribing. As someone who played a little sport growing up, I understand the value, both physically and mentally, that comes from playing sports, whether as a part of a team or individually. But activity alone is not the silver bullet, and that is why new treatments in obesity are so exciting. In clinical trials, some have shown the ability to cut people's weight by up to a fifth. And the technology may not be new, but the way we intend to use it is. Now, having been used by GPs and hospital doctors to manage type 2 diabetics for more than a decade, the way we intend to use it, where we put aside 40 million for pilots to manage obesity in primary care, is truly innovative. Now, some on the left will no doubt turn up their noses and criticize those who use treatments for obesity. But we will follow the evidence to ensure that people who stand to benefit can do so. Failing to roll out medicines would not make sense for the individual, and it would not make sense in terms of the interests of the NHS, which already spends 6.5 billion a year treating obesity and the conditions it causes. I want to ensure that treatments of this type, which can reduce the burden and the risk of serious health consequences, are provided on the basis of need. The health benefits matter in Hartlepool and Hastings as much as they do in Harley Street. And there is much more we can do to replicate this personalised approach. Yesterday I was in Nottingham with the Prime Minister visiting a lung truck in a supermarket car park which has been offering targeted screening for people who have smoked and are at elevated risk of lung cancer. The intervention has been hugely successful in turning around the late diagnosis rate. Previously, 80% of lung cancer cases were diagnosed late. Now 76% under the pilot are being diagnosed at stage 1 or 2. So literally turning the detection rate on its head. And that in turn unlocks far better survival prospects. But it's based on a simple idea, focusing our efforts on those at higher risk. Equally, take another area where patient safety matters hugely, that of maternity care, where we're exploring how artificial intelligence can recognise patterns that identify mothers who may be at greater risk of complications when giving birth. This is hugely important to patient safety in allowing a much more tailored support package to be put in place to protect both the mum and baby where risks are identified. My department is actively working on how we can use PopUp Screening, and John and I have been discussing this specific point, and also build from the lessons of COVID on home testing, something we will have more to say on in the major condition strategy, which we will publish later this year. And this is not just about loading more pressure and expectations on the NHS, quite the opposite. I believe that early intervention can save us money in the long run. But more important than that, early intervention improves patient outcomes. Prevention should be at the cutting edge of healthcare. It's amongst the most exciting parts of my job as Health Secretary. And if we work together, we can deliver a conservative vision for prevention, one that decisively rejects Labour's one-size-fits-all approach and instead embraces technology and innovation, giving people the knowledge and power they need to make their own choices about how they live healthier and happier lives. Thanks very much.